The maker of Tylenol is asking the FDA to not change its label to include a possible connection to autism. The FDA said it would review the issue after the president claimed Tylenol used during pregnancy could cause the neurodevelopmental disorder. There's no research to support that. Health reporter Stephanie Stahl has more on the fight over the label change.
Don't take Tylenol.
Kenvue, the maker of Tylenol, is pushing back against a potential label change on its pain reliever. That follows President Trump's unfounded claims last month that Tylenol use during pregnancy was linked to, quote, a very increased risk of autism.
I'm just making these statements from me.
Since then, the FDA sent notices to physicians saying that the choice to take acetaminophen, the main ingredient in Tylenol, still belongs with parents, but that use during pregnancy may cause an increased risk of neurological conditions such as autism and ADHD in children. However, the letter also noted that a causal relationship has not been established.
Anytime a different voice is added to the conversation, it causes a bit of confusion, especially if the messaging is completely different.
Dr. Brian Lee, professor of epidemiology and biostatistics at Drexel University, says while there is no debate that rates of autism are increasing, his study published last year in the Journal of the American Medical Association found that there was no increase in risk of autism or ADHD associated with acetaminophen use.
Acetaminophen remains the safest alternative for pain relief medication, and it's unclear what exactly would replace that.
An anti-vax nonprofit with close ties to HHS Secretary Robert F. Kennedy filed a citizen's petition asking the FDA to add a more detailed warning to non-prescription drug products containing acetaminophen. Kenvue asked the FDA to deny the petition, saying that suggested label changes are unsupported by scientific evidence. The current label instructs people who are pregnant or breastfeeding to ask a healthcare professional before use. Doctors say Tylenol is one of the few medications that pregnant women can safely take, and that untreated fevers are potentially very dangerous to the mom and baby. I'm Stephanie Stahl, CBS News, Philadelphia.